Welcome back, my people. I know so many people are wondering why we are making this video in a very unusual place. This is not my normal place where I always shoot my videos. And as they say, masaa ni mengi. Okay, mambo ni mengi, masaa ni machache. I have so many topics which you guys have given me and which you guys want me to cover and educate you on. So I have to fix myself wherever I am. I have to fix myself to make sure I cater for your needs, guys. I don't want to let you down, guys. So for those who have not subscribed, let's continue subscribing, liking and sharing and make this channel a success. And before we go back to our topic of discussion, I appreciate your support, guys. So let's get back to syphilis. And in this video, we are discussing about the treatment modalities which are available. We have discussed the stages of syphilis, and I hope, guys, you have got them: the primary, secondary, latent, and tertiary. And now, let's see. After diagnosing that a client or a patient is having this kind of a disease, how can you treat this disease? How can you treat this disease? So, primary and secondary syphilis are easy to treat using penicillins. This means treatment of choice in this kind of a disease is always penicillins. And for those who are medical health practitioners, you know what I mean by penicillins. So, this is the most likely drug that can be used to treat a patient having this kind of a disease. So, you may find that other people are allergic to penicillin. And there is always an option when somebody reacts to a drug. Because we can't treat you with a drug which you are allergic to, because it will cause other health problems. So, if you are allergic to penicillins, what other drug can you use? You can use doxycycline, and also you can use ceftriaxone in form of an injection. Note this: neurosepsis, or as we have discussed in the previous video, neurosepsis is not sepsis. Neurosyphilis, or syphilis that can be transmitted from mother to child during pregnancy, or when the mother is expectant, needs daily doses of penicillin intravenously. Intravenous means through the vein, direct through the vein, not through the mouth. Because we have several routes of drug administration. You can administer through the mouth or swallowing. You can administer through the vein, which is also called intravenous, or you can inject in the muscle, which is also called intramuscular. So, neurosepsis or sepsis, I don't know why I'm calling it sepsis. Neurosyphilis or syphilis, which affects an expectant mother, or which can be transmitted from the expectant mother to child, needs daily doses of penicillin intravenously. So, damage caused by syphilis is irreversible. What does it mean by irreversible? Irreversible means it can't be reversed, or it can't be taken back to normal. I hope you get this. So, and this is very important. Avoid sexual contact with sores during treatment till sores are healed. Remember, these sores carry the syphilis bacteria. So, avoid sexual contact with the sores during treatment till the sores are healed and your doctor or your healthcare provider confirms Note this: avoid sexual contact with the souls during treatment till souls are healed and your doctor tells you that you are safe to resume sex. If sexually active is somebody who is always, his or her mind is always on sex or can't do without sex. If sexually active, your partners should be treated well to avoid what we discussed before, to avoid reinfection or spread. Note this, and guys, this disease is very common and it's very dangerous and life-threatening. Note this: don't resume sexual activity till you and your partner are treated well and your doctor confirms that you are free or safe to resume sexual activity after completing full treatment. I hope you get this. Another point to note: the Jarisch eczema's reaction, or JHR. I know this is very hard to understand, but it's a reaction or a short-term side effect of syphilis treatment, or it's a reaction or a side effect that can occur during treatment regimen for syphilis or when using the penicillins or the treatment for syphilis. So Jarisch eczema's reaction simply means that reaction that comes about as a result of the drugs used during treatment for syphilis. I hope you get that. So the Jarisch eczema's reaction, or JHR, is a short-term side effect of syphilis treatment. Fewer, and this is very important, fewer than 30% of people with primary or secondary syphilis, and note this, fewer than 30% of people with the primary or secondary syphilis may experience JHR, or Jarisch eczema's reaction. So fewer than 30% of people with the primary or secondary syphilis may experience this kind of a reaction or symptoms within 24 hours. So Jarisch eczema's reaction is an immune system reaction that causes temporary symptoms that range from mild, get this, Jarisch eczema's reaction is an immune system reaction that causes temporary symptoms that range from mild to more intense reaction, including fever, chills, skin rash, gastrointestinal symptoms or GIT symptoms, for example, nausea and vomiting, headache, joint and muscle pains, and so forth. Note this: JHR, or the Jarisch eczema's reaction, or this reaction that occurs as a result of syphilis treatment, disappears within hours. Let's discuss how we can prevent syphilis or prevention of syphilis. The best way to prevent syphilis is what we call practicing safe sex. What is safe sex? This is whereby we use, or you have to use, protection or condoms if you have to do if you have to do sex. This means simply you should avoid unprotected sex. I hope you get that. Number 2, avoid sharing sex toys. For the ladies who use dildos and all that, just avoid sharing them, as you may transmit the disease from this person, or from point A to point B, or from one person to another. Point number 3 on how we can prevent this kind of diseases by screening. And this means proper screening for STIs and talking to partners on the results. If you get screened and you are a lady, go talk to your partner or your husband about the results. If they are positive, explain to your husband that I've been screened for syphilis and it has tested positive, so that your partner may also get treated. Number 4, avoid sharing needles if using injected drugs, as sharing needles comes into contact with the blood, which carries the bacteria. So if I inject myself and I have this kind of disease and I transfer the same needle to you, I'll be transferring the disease to you, from my bloodstream to your bloodstream. Let's discuss about the complication, or the final part. In every disease we discuss, we have to get to the final outcome, or what will happen if this kind of disease is not properly managed or properly treated. So what are the complications of syphilis? So untreated syphilis can cause, 1, what we call gammas. What are gammas? Gammas are masses of dead swollen fiber tissue in liver, heart, skin, eyes, bones, and testes. Number 2, it can cause blindness, which is also a serious complication. Number 3, it can cause hearing loss. Number 4, it can cause brain damage. Those points are self-explanatory. I don't need to explain more, because if I tell you about hearing loss, obviously you lose your ear sight. Eye loss, you lose your eyesight. The next one is paralysis. Next, you can have what we call heart valve damage. It can also cause what we call aneurysms. It can also cause aortitis. This comes from the word aorta. So aortitis simply means inflammatory aortic disease. I hope we are together up to that point. So when, and this is very important, guys. Many people have requested this topic, that's why I'm emphasizing on the major points. When should one test for syphilis? Number 1, when you have had an unprotected sex. Number 2, when you are pregnant. And this is obvious to all pregnant mothers. When they come to the health facilities, we always do what we call VDRL tests. And this is specifically for syphilis. Number 3, if you are a sexy worker, if that is your job, or your job is doing sex work means you are doing sex for payment. So you should get screened for syphilis, because you meet several people and you don't know who is sick and who is not sick. Because not many of us usually remember to go to the health facilities and get tested, because they get involved in sexual intercourse. Those who are in prison should also be tested. Next, another group of people that should be tested are those who have unprotected sex and with multiple partners. You hear people enjoying and talking about threesome, those kind of nonsense. If you have multiple sex partners, you should get tested for this kind of disease. The final group who should get tested for this kind of a disease are gays. And who are gays? Gays are men who have sex or do sex with their fellow men, of which we should avoid this. So, gays or men who have sex with their fellow men should be tested for the same. Guys, this marks the end of our discussion about syphilis, and I hope, guys, it has helped you guys. For those who had requested this topic, because I had more than 10 people requested for the same, I hope you have got what you wanted. And for the others who have presented their topics, just be patient with me, because it's not always an easy job. And definitely I will arrive at your topic, I will discuss it, and you will see a video of the same. Guys, let's continue subscribing, liking, and sharing our videos so that they may reach as many people as possible. And I do appreciate your support. Thank you for the far you have taken me, and I hope this channel will grow and grow bigger and bigger with your support. Guys, have a good evening, and let's meet tomorrow in our next topic, and may God bless you.